You're listening to The Nourished Child, episode number 110. Today we're chatting about ADHD, and not so much the management of it, but some aspects about nutrition I think you should understand. Too many times I've seen parents take food away from the diet rather than focus on adding nutritious foods. As a result, nutrition can suffer, and that places kids at risk for added complications, ones that are really absolutely preventable. That's just one example of the mindset shifts I want all parents to have when it comes to nutrition and ADHD. We'll dig into more overarching themes like this in this episode. But for the role of nutrition, specifically what to feed kids with ADHD, how to do it in positive ways, and how to make sure they're getting what they need nutritionally, I suggest you consider taking my program, The ADHD Diet for Kids. It's a robust training for parents focused on proper food, adequate nutrients, structure around feeding, and navigating those common nutritional challenges like nutrient deficiencies, picky eating, and negative mealtime dynamics. You can find that course over on my website, but I'll also include the specific link in the show notes for this episode, which will be available over on www.jillcastle.com/110. That's 110 for episode number 110. Also, today is the last day to enroll in the Nourished Child Blueprint, my program for parents to help them get absolutely clear on feeding kids from toddlers to teens. This is the nutrition program I wish all parents had when they started out. It clears up so much confusion about what to feed kids and how to do it, setting them on the right path to raising good eaters who actually want to make healthy choices for themselves and who grow up with a good relationship with food. Head over to jillcastle.com/TNCB. The Nourished Child Blueprint is what that stands for, TNCB, for more details. And I'll include that link also in the show notes in case you forget it. In other news, I do have some big news on my business front. I have decided to retire, close, suspend, whatever word you want to use here, my private practice of 12 years. I'm feeling pulled to do more preventative work rather than corrective work, and I'm listening to that gut feeling and the voice in my head that's telling me it's time to move on. So, as of now, I am no longer accepting private clients. However, I am launching a brand new parent education website called, wait for it, The Nourished Child. You'll find it at thenourishedchild.com. It hasn't been released yet, so at the time of this recording, I am still working on it, but it will be coming very soon. The website will host classes for parents and children, as well as other supportive resources to help families learn about nutrition and feeding and make the whole topic of childhood nutrition easier to understand and implement on a day-to-day basis. I've been dreaming of this idea for a long time, and I'm finally going to go for it. My vision is to collaborate with insurance companies and corporate wellness programs to make these resources available to employees and as part of benefit packages for families. So, my friends, if you have ideas or connections to help me move this along, please let me know. As the saying goes, it takes a village. I'll be working hard over the summer to ramp this new website up, and as such, I'll be taking a small break from this podcast. Don't worry, I'll be re-airing some of my favorite shows, and actually, I'm not sure if I'm really re-airing right now my favorite shows. I'm doing a combination of shows. It's still up in the air, but I will be taking a pause on live brand new shows just for the summer with a plan to be back in the fall with brand new shows. So that's enough about me. Let us cue the music.
Welcome to the Nourished Child podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Okay, we are talking about ADHD today. Attention, deficit hyperactivity disorder. This condition affects approximately 11% of children in the United States, according to the Centers for Disease Control, the CDC. It can alter a child's ability to pay attention, behave, and learn. ADHD is managed by using a behavioral modification focus for young children, and for older kids, it's managed by using a combination of medication and behavioral approaches. As you probably already know, my bias, nutrition is important for every child, but particularly for the child with ADHD. Sadly, nutrition is often left out of the conversation, or it's placed at the end of the list of things to address. Yet, real nutrition challenges are a reality for kids with ADHD. Things like picky eating, poor eating or diet quality, weight loss, growth disturbances, nutrient deficiencies, and of course, negative interactions around food and negative family dynamics around feeding are more common than we all like to admit. The kicker? Challenges like these make it harder to fully nourish the child with ADHD, and as a result, poor nutrition can potentially interfere with a child's daily functioning. So, the brain is dependent on many nutrients to function at its best. Protein and fat and carbohydrate, along with micronutrients like iron and zinc and omega-3 fatty acids, have all been highlighted in the research as particularly important for brain growth, development, functioning, and health. And these nutrients are essential for a child's overall growth and development. Research tells us that good nutrition can help with ADHD management. It can reduce the chances of poor growth. It can reduce the occurrence of malnutrition and bad eating habits, and it can even help kids feel better and function at their best. But sometimes we overplay what nutrition can do for kids with ADHD. So there's some key, in fact, there are 5 key understandings about the role of nutrition I think you should understand. And not only just parents should understand this, but healthcare providers should understand it too. So I want to go through these 5 different areas with you. The first concept is that nutrition is complementary, not curative. So I often see conversations on social media. In fact, I just had a conversation with a parent not too long ago that kind of went along the lines of nutrition can cure my child. And I see this on social media too. These comments that, just change the diet, add this food, take that food away, and your child with ADHD will be cured. Or conversations that say that nutrition can prevent ADHD from developing. Special diets like gluten-free, casein-free diet, or supplementation with specific nutrients, or even just promises about certain foods will cure this or do that. These things are out there and they are rampant. But the truth is, optimizing nutrition can help kids with ADHD, but it won't cure it and it won't prevent it. If you look at the research, studies tell us that a well-rounded, nutritious diet is a complementary treatment to using behavioral modification and medication approaches to managing ADHD. In other words, good nutrition helps ADHD treatment work even better. So what you need to understand is that the brain function and its health is dependent upon, in part, a diet full of healthy fats, protein, carbohydrates, and a variety of nutrients. And the best way to target all of these things is to offer a variety of foods from the main food groups, like protein, grains, fruits, vegetables, and dairy during meals and snacks. These foods should provide the lion's share of nutrition for your child with ADHD. And those foods that give empty calories, so those are foods that have calories, but the calories are coming from sugar and fat and not really loaded up with actual vitamins and minerals. Those types of foods should play a minimal role in the diet for a child with ADHD. Okay. So again, just nutrition is complementary. It's not curative. Secondly, special diets can help, but they can also do more harm. So it's hard, again, to tune out these promises around special diet modifications for ADHD. You'll see things like follow the keto diet or remove dairy or gluten. Yeah, that catches your eye, but there's little evidence that any of this works in children with ADHD. It's actually reported that up to 19% of children with mental health issues use complementary and alternative medicine approaches. Things like special diets will fall under this umbrella. Elimination diets, where you take out allergen-containing foods like egg or wheat or milk, are also being used by about 12% of children with ADHD. But there's just a limited set of data in children with ADHD that suggests eliminating certain foods or altering dietary components will actually do anything to improve ADHD symptoms. One study in 2014 estimated a 10 to 30% chance of improvement using a strict elimination diet, but generally estimated a 25% chance of some symptom improvement overall. So it's important to emphasize that elimination diets may be helpful, but they have not been proven to be effective or helpful for all children with ADHD. So we have to really kind of look at our individual child and be curious about what food components might be causing problems. But remember, you can create problems by eliminating foods that aren't causing problems. So what we know is that children need a full complement of nutrients for their developing bodies and brains. So when we take out or eliminate dietary components, we may inadvertently leave out important nutrients, or we might compromise our kids' eating, leaving more inadequacies in the diet and potentially further complicating ADHD. So for example, if you take out dairy, that means you're taking out calcium and vitamin D, potassium, phosphorus, and you're potentially interfering with overall protein intake, for example. When we take out gluten, this oftentimes will remove B vitamins and fiber from the product, and they're a lot of times not added back into the product. This can cause inadequacy in these nutrients, and it can also reduce overall fiber intake. And we know when that happens, that can cause constipation. I talked about this in episode number 79. You can listen to that show to learn about home remedies for constipation. But I know constipation is a big concern for a lot of kids, and it is for children with ADHD as well. So what can you do? Focus on adding nutritious foods to the diet rather than taking out foods from the diet. If you think your child might benefit from a special diet, or if you think your child's sensitive to certain foods or food components like food dyes, for example, which I'm going to talk about next, consult with a pediatric dietitian or your pediatrician first so that you can get the guidance you need, particularly as it pertains to your child, so that you can avoid unintended consequences like weight loss, poor growth, or a nutrient deficiency. What I oftentimes see is that parents get really excited about starting a particular diet, and they're not really thinking of the overall impact on their child. So, for example, if a child is really barely making their weight gain and aren't growing very well, it doesn't make a lot of sense to put a child on a restrictive diet if it's going to interfere even further with their growth and development. Sure, if you have a proven intolerance or a proven allergy and those things need to be removed, then by all means consult with a nutrition professional and do it in a manner that allows your child to keep growing. But if you're just doing it because it's the latest thing all your friends are talking about, or you're seeing on social media that you may need to remove gluten or you should remove dairy, I would caution you on taking that approach because it can do more damage than good. Okay. Thirdly, let's be curious about added food ingredients. So some parents will tell me that they see their child's behavior change right in front of their eyes whenever he or she eats a certain food ingredient like sugar or artificial food dyes. And yes, it is true that some research suggests that children may experience changes in behavior, especially if hyperactivity is part of the diagnosis. But it's important to note that not all kids experience this. I think you should be curious about the effects of food additives, about sugar and artificial food colors, because we have a higher tolerance for those added ingredients in the United States than, for example, Europe does. So be curious about those effects. Don't assume they're having an impact, but go ahead and test it out. You can take a hard look at your family food supply, see where there are lots of food additives or artificial food colors in the diet. You know, if you have a lot of packaged foods, boxed, bagged foods, colorful foods and cereals or sugary foods, those are the first things to sort of dial back on and see if your child's behavior changes. There is one researcher, Laura Stevens, that I interviewed in episode 22, and she talks about food dyes and ADHD, and she actually suggests taking a 2-week break from sugar or food additives or artificial food dyes, and then give a significant dose of it. If I remember correctly, she suggested taking food dyes and mixing it into water and giving a dose to your child and then watching the behavior afterwards. And if you see negative behaviors start, then you can pretty much figure that your child is sensitive to food dyes, for example. But if you offer that dose and nothing happens, then your child probably is not affected by food colors. So you might want to listen in to episode number 22 with Laura Stevens. We talk about ADHD and food dyes in that episode. But I think it's important to recognize that every child with or without ADHD can benefit from cutting back on highly or ultra-processed foods. And I think that we also have to have an understanding that there may be different influences on a child's behavior outside of food. I don't think we should always take our finger and point it at food, because when kids get into a new environment, they go to a party and they're in that atmosphere, or they're using screens, they're on their computers or playing video games all day long, or their friends show up to play, kids get excited and they can be very excitable about those things. So I think, again, be curious about food. Don't point the finger and assume food is the reason why your child's behavior has changed, but go about it in a strategic way, in a systematic way to really evaluate if that is the case. Now, I would say a word of caution: if you decide you're going to be curious about dairy and you take that out for 2 weeks, fine, do that. But remember, we eliminate for a reason, and the reason is to figure out if that potential food is causing a problem. If we eliminate and reintroduce it, and that is part of the elimination diet, take it out for a period of time, reintroduce it, causes a problem, then you can be convinced that it is a problematic food and it doesn't have to be in your child's diet anymore. But if that is the case, then you need to go on the journey of finding those nutrients that you've removed and replacing them. But if you do decide to do an elimination diet with a food group like dairy or gluten, you do need to have a plan for adding it back in. It's not just take it out and leave it out unless it really needs to be left out. So I want to just make sure that you understand that when we do elimination diets, it's for a prescribed period of time, and it's to evaluate whether that particular food was a problem or not. So in order to be able to evaluate that, we have to add it back in and see if we're seeing the behaviors that we are assuming those foods are causing. So I just want to clarify that a little bit. Okay, so just from the top, the first thing to understand is that nutrition is complementary, not curative. The second thing was that special diets may help or they may do more harm. Thirdly is to be curious about added food ingredients, such as food dyes, food additives, and sugar. And then fourth, and I think you probably already know this, is that medications may impair appetite. So some medications like stimulants, for example, are used to treat ADHD, and they may interfere with your child's appetite and his eating. In fact, research has shown that up to 60% of children on ADHD medications experience a loss of appetite, while 40% report abdominal pain and 20% complain of headaches, all of which can reduce your child's eating. I get into the specific medications and their effects on appetite and eating in my ADHD Diet for Kids program, so you can check that out if you want to. If you're a parent of a child with ADHD, you know already that many kids take their medications in the morning so they function better at school. As a result, these medications can turn off their hunger and appetite until the medication wears off, which is usually at the end of the school day. Over time, skipping meals at school or under-eating lunch can lead to inadequate nutrition and cause some children to experience weight loss, poor growth, and nutrient deficits. So what can you do about that? Well, I think you should be Johnny on the spot when your child's appetite kicks in. Make sure you have nutritious foods available when your child's appetite is good. And that's going to be generally before you deliver medication and after the medication wears off. For kids who don't eat well at school or during that middle part of the day when their medications are in full swing, send in healthy snacks to nibble on. Sometimes kids will do okay with just a small snick snack that they can bite into here and there, that they don't have to really sit down and consume a whole meal. You could send in a bottled smoothie or shake to drink. And also consider a bedtime snack to improve your child's overall daily intake. And last, or fifth thing to understand if you have a child with ADHD, that is diet quality matters way more than the quantity of food that kids eat with ADHD. Now, of course, your child needs to eat enough food in order to get enough calories and protein to grow well. And in fact, kids with ADHD who are growing well are likely getting enough calories, but they may not be getting the nutrients they need. It's true that some kids with ADHD are overweight and shockingly undernourished. I've seen kids who were normal weight or even overweight with nutritional deficiencies like iron deficiency anemia and vitamin D deficiency. So you can't judge the nutritional status of a child by the way they look. And many of us, parents and healthcare providers alike, have sadly made this mistake. Certain nutrients in particular are at risk for deficiency in children with ADHD, including magnesium, iron, protein, and omega-3 fats. Also, it's not uncommon to see nutrient gaps in the diet, such as vitamin D, omega-3 fatty acids, iron, zinc, and fiber, for instance. And then if you have a child with ADHD who is also selective about food, so he's a picky eater or she's a picky eater, they are at higher risk for nutrient deficiencies. Iron deficiency, for example, can impair sleep, and it is associated with restless leg syndrome in children with ADHD. So you can imagine a tired child who is sleep deprived and in constant motion will find it difficult to behave well, pay attention, and learn. So what can you do about this? I think, if you have a child with ADHD who likes to snack all day long, who's a big snacker, that may be a red flag for a poor diet. It really depends on what he's snacking on. Is he snacking on a lot of packaged foods, or are you providing snacks that are well-balanced and from wholesome, nutritious foods? Don't let the outward appearance of your child lead you to falsely assume he is well nourished. Don't be afraid either to evaluate your child's diet with a qualified, trained professional in nutrition. You can address those nutrients that aren't enough in your child's diet through improving food intake. You can do it with micronutrient supplementation or a combination of both. It really helps to consult with a trained professional in this area if you can. I cover all of this in my program as well. There is so much you can do to address food, nutrients, feeding strategies, and building autonomy with eating in children who have ADHD. Again, if you want to learn more, improve your child's diet and eating, and the whole vibe around food, check out my program, The ADHD Diet for Kids. I hope that you'll look at nutrition as an essential part of treatment, be curious about the needs of your individual child, and keep working on nutrition to help him or her grow and function at his or her best. Next up, in episode 111, I'm talking with Dr. Frank Mitloehner, the greenhouse gases guru and professor at UC Davis in the Department of Animal Science. He's going to help us understand greenhouse gases and the carbon footprint so we can share this information with our kids. I'm super excited to share this interview with you. As always, thank you for joining me today. I do hope you have a lovely day. Stay well, stay healthy, and most importantly, don't forget to give that child in your life, big or small, a loving squeeze today. Bye for now.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.